Now, South Africa is facing a critical moment in its fight against HIV/AIDS due to recent international funding cuts. Health Minister Aaron Motsoaledi is determined that the country will find other funding avenues and move away from reliance on international aid.
We believe it's high time that we become self-reliant as a country. We need to plan on that. But we didn't just sit and say we're waiting for that self-reliance. I've had lots and lots of meetings, including even yesterday, with other funding agencies around the world. But many of them, to be honest, they told us that we are going to try our best to help, but will not be able to replace the US in its totality. So the third thing we are doing because of that is to look at what is the part which you can take and at what level. We can't just say everything that was there is going to get replaced. No funder has been able to tell us that. Even funders that are governments, and they tell us straight that we are going to try and come in, but don't think we'll be replaced anything. Now, the other fact you must remember, there is no funder or no government which had put money aside and say we are waiting for eventuality when something like this is done by Trump. Nobody foresaw, even though they knew his policies before he came in, but nobody saw this, this sudden, disruption of what's happening around the world, which has been happening over ages. So they have to sit back and think and see where do they start building up some resources in order to help. And that's going to happen. That includes Global Fund, which was established 2 decades ago to fight HIV/AIDS, TB, and malaria. Global Fund meets every 3 years to do what is called a replenishment round, put money together and see where they can help. Coincidentally, their next replenishment round is in September and it's going to be in South Africa for the first time in 20 years. It has never been on the African continent. We're already having discussions with them, with the president of Global Fund and other stakeholders. Can we ramp up more than what we have done in other years because of this problem? So all those plans are in the pipeline.